but he had been wearing earplugs. I didn't know that he had a buildup of wax. Now he's like our #1 irrigator fan.
Yeah.
He's in town. He's like, will you clean my ears?
Welcome to the Hearing Wellness Journey podcast, an exploration of determination, hope, self-discovery, and triumph. We'll share the personal experiences of those that are living with hearing loss and provide a haven for their stories to show others that they are not alone in this journey.
Welcome back to our latest episode of the Hearing Wellness Journey podcast. My name is Dr. Dawn Heiman.
Dr. Stephanie Michaelides.
Dr. Emily Johnson.
And Lindsay Doherty.
And today we are discussing earwax. It's the fascination of the thing that you don't really want to know about, but you kind of want to do.
Is it friend or foe? That's what a lot of people want to know.
And when we take it out, we're always like, oh, it's so satisfying.
And the patients, though, because they
Absolutely.
We're not podiatrists. Don't ask me to touch your feet.
Absolutely
Okay.
not.
What do we usually see? Someone says that they need an appointment because their ears are clogged and they think they have wax.
Yeah. Or they have a history of wax buildup. Their primary care has told them that they have wax, but their primary care won't take it out. And they watched on social media, on TikTok, an earwax removal, and they're like, that was really cool. I'm going to call to see if that needs to be done to me. And then they show up, and we take a look in their ears, and lo and behold, full of wax.
Mm-hmm.
Or lo and behold, there's no wax. And we have to do more testing. Seriously, It's a sudden sensory neural hearing loss. Who saw the young lady the other day that we'd already seen before?
Me.
Did you see her the first time, or was that you?
With the water lavage?
With the water lavage,
Yeah.
no.
And
Last
we did a
time,
video. I actually never posted that. She was so excited to have her ears cleaned.
yes.
Well, because she was so occluded. She couldn't
Yes.
hear anything.
Well, they heard her at the urgent care.
Oh, yeah.
Yeah.
That's happened too.
Yeah. So she was seen about 8 months ago for wax removal, and it really only builds up on one side. And so that can come down to ear canal anatomy, how curvy it is, and just the oiliness and the little hair cells inside your ear canal that make the wax. Your ears are cousins. They're not twins. So they're not always going to produce the same. And for her, she had it removed about 8 months ago. She was then feeling like it's a little clogged up. I think I need to have it removed again. And this time she had water lavage done with our irrigator. And it took a while for it to get removed because it was deep in her ear and actually a lot more than what it looked like on otoscopy, which is when we look in your ear with the light. And the relief that she felt when it was out, she was like, whew, I didn't realize like how much that had been bothering me. So
It could be painful.
Yeah.
Having all that wax in there. It can be
Yes.
really painful.
super satisfying for her, super satisfying for me. It was really enjoyable to take that wax out.
But back to what Lindsay said with friend or foe, people need to know also that having earwax, it's protective. You know, we do, like everyone has earwax in their ear for some reason, you know, but I find if you guys have ever heard of swimmer's ear, that's a bacterial infection. And what happens is especially they're swimmers, and that earwax is constantly getting washed out. So what happens is bacteria then can grow in there and that they can get an outer ear infection because they're not having that protective wax in there. Yeah. So having a little bit of wax is a good thing. It's just when it gets to what Dr. Johnson just said is when it gets to that point where it's painful, it's occluding, that's really when we come to the point to remove it.
I think we're seeing it more and more in young folks because of the earbuds.
Oh, yeah.
It's pushing it in. I'm going to call out my son. I won't tell which son. But yeah, if you're wearing AirPod Pros, Beats, whatever it is that's pushing in. We were on a trip. We were looking at schools and we were in Nashville actually. And there were some people rolling in the middle of the night from being out late. And we were in the hotel and you could hear these people partying down the hallway. And I asked them, hey, do you want earplugs? I'm like, funny, your mom's an audiologist. Guess who's got earplugs, right? And I go in my backpack and I get myself a pair. I have my customs and I have a pair for him. And I go over to his bed and I pull on his ear canal and I take the little foamy thing and I shove it in real deep, like, oh, I'm like, suck it up, right? And then I go to the other ear and I do
It's
the
good for
same
you.
thing, right? So anyway, I put my earplugs in, we fall asleep. Next morning, I get up extra early to go downstairs and get some coffee and do some work in the little cafe. And he calls me and he goes, Mom, whatever you did, my ear is killing me. Can you do something about it? He's like, I actually feel sick. And I was like, oh, I have nothing with me. I don't have an otoscope. I don't have a cure. I don't have anything, right? So I use the flashlight on my phone and I look and I was like, oh my gosh, like he is completely occluded. So then I start calling around to friends that are around Nashville and Tennessee, and the closest that we could maybe get him in was a couple hours south in Chattanooga. And then I was like, okay, let's go to Walgreens. We walk down the street to Walgreens. We get the little kit. We get the Debrox. Got that little flushy thing. And it takes forever for me to really fast suck it up, flush. No, keep going, keep going. And eventually this huge thing pops out of his ear. But he had been wearing earplugs. I didn't know that he had a buildup of wax. Now he's like our number one irrigator fan.
Yeah.
He's in town. He's like, will you clean my ears?
He was our first.
He was our first when I sprayed the wall because I didn't know how to use it. Yeah. But
We've improved since then.
I know.
Significant.
that I'm very good at it since then. That's what we can prove. Yes. Because you can practice on your kids. Yeah. I don't know. It's stuff builds up. It's a sebaceous gland. Just like if you wore a white t-shirt and the armpits could yellow because you're sweating and little oils are there, that's what's happening in your ear canals. So some people have the gene that they produce more than others. Sometimes depending on the year, or if you have seasonal allergies, you're going to have more of a buildup. And some people are on a schedule and we're cleaning their ears all the time. Some people never get wax.
Yeah. I think that's important to for people to hear that it can be a genetic thing, right? Is a genetic thing. And it doesn't mean that you're unhygienic. It doesn't mean that you're dirty. It doesn't mean that you should brush your teeth, before you go to the dentist, or you should try and clean your ears before you come here. Like, no, don't do that. That's what they're here for. to
Nothing
help
bigger
take care
than your
of.
elbow to go in your ear, right?
That's right.
No Q-tips.
Should I tell my mom's story?
Oh no.
Yeah. Okay, so
don't
I grew
remember
up my
this.
mom saying never put anything smaller than your elbow in your ear.
Oh.
And she was a nurse.
It's very smart.
What did I say?
I think I said nothing bigger.
Oh,
And did I repeat
don't know.
that?
I
Okay,
don't know.
nothing
It's
smaller.
Smaller.
anyway,
Yes, don't put
don't
anything
think
in your
that
ear.
Exactly. So my mom calls me like 10 years ago and she goes, oh, I just want you to know that I was using a Q-tip and I slipped. And I punctured my eardrum.
Yeah.
But I'm
yeah.
okay.
No.
I already saw the ENT and it has healed. I just wanted you to know. Like she called me after everything was healed. The person who told me never to use something. Oh, do not let little kids see you put things in their ears. Oh, I will never unsee the story or the kiddo that I saw at Temple Children's years ago in Philadelphia. It was a baby that the preschool brother thought it was cool to put the Q-tip in and then jam it in. That
thank
poor
you.
little baby. Oh my gosh.
No, I had another patient that the dad was holding his 2-year-old and he was cleaning it and the same thing. And he permanent damage.
Yeah.
Permanent damage.
And you just
Oh my
push all
gosh.
those
Yep.
little bones out of the way.
Permanent damage.
Like so bad.
The fact that we all have this sort of story, because I was
Yeah.
waiting to jump in with my not personal, thank goodness, traumatic ear cleaning Q-tip story of somebody was cleaning their ears, as you do with the Q-tip, and then they were standing next to the door. And so somebody came into the bathroom and hit their elbow.
Oh.
So I'm like, if at all costs, if you're going to do it, don't go that deep in your ear, number one. Number two, lock the door.
No, just
Like-
don't do it.
Don't let somebody come
Don't do
in
it. Don't do
because
it.
it's not worth
The pain.
the pain, the really negative side effects of having
The
a Q-tip
reconstructive
go
surgery.
Even with that though, how many times do you pull out cotton
Through. Yes.
Oh yeah.
from ears?
Yes. It gets stuck in
All
your
the
ear
time.
too.
And we're like, you use Q-tips, don't you? You're like, how do you know? Let me pull this stuff out. Or they
Yeah.
come in, Lindsay said something about don't clean your ears before you come in. Do you know how many people I've seen where they have contusions, they have bruising of their ear canal and their eardrum because they really wanted to clean it good before they came in? And we're like, ouch, what are you doing? Don't do it.
Leave it to us.
Yeah.
We got you.
We can actually see in your ear.
So when does wax become a problem? Like what problems can it manifest into? Obviously, if we get like a plug where all of a sudden we can't hear,
That's it.
Mhm.
I think that's
Yeah.
the problem, right? 95% of all the phone calls answer is it's wax, and they never believe us.
and this does affect hearing aid wearers
Yeah.
as well, where wax, it can clog your receivers, it can clog up your domes or whatever the earpieces that you have in there if it's custom, and it just needs to be cleaned. And you can do that at home sometimes, or you need a little bit deeper clean with the extra special tools that we have or other audiology offices do have.
Or we refer to people like your husband, if we can't, if it doesn't look at, if it's something that something's growing in there, it's bacterial, it smells, we're going to refer you.
Oh, for sure.
Sometimes you need it suction. Sometimes it's like but don't self-treat. How many
Right.
times have I been told about the car keys?
How about the thing, it's like, I don't know if you buy it at the
Yeah,
drugstore, but
it
it looks almost like a threaded drill head.
Oh,
I have one.
yes.
We
People
do
keep
have
giving them
one.
to us. They're like, "Do you think it didn't work? Do you want
Right.
this?" When it says "as seen on TV," no,
Don't
Red
do
flag.
red flag.
But it like you're twisting it in there. It doesn't matter
It's just
what you're doing.
rotating.
It's just rotating and jamming it in there deeper.
Oh my gosh!
So
Can we talk about the candling of ears?
Oh gosh,
Oh.
I've seen someone burn their actual eardrum. With
Oh,
no.
Yes, because the hot
Terrifying.
wax.
Terrifying.
Hot
No,
wax
thank
going on.
you.
Yeah.
I want no part of that.
And if so, I think Cliff Olson has done this. Other people have done it where they do video otoscopy, so you can see before the ear candling that there's no wax in the ear. Then they lay the person down and they put the candle thing on, and then all this stuff is supposed to like come out, and it comes on this little plate thing, and they're like, "Look at what we got out." But there was nothing there in the first place.
It's just wax from the candle.
It was wax from the candle, exactly. It
Yeah.
has this like suction effect, and people swear by it. They're like, "Oh my gosh, I feel so much better." It's a placebo effect. And you just paid money for that. And there's a chance you get burned.
Or even your hair.
Flames.
Oh.
Your eardrum.
Flames near your head is just never a good idea. There are much safer alternatives to having your wax removed.
Yes.
Or if you just need to relax, like go find a spa that just gives you a massage, or even just a hand massage would probably be better than an ear candling with the chance of being
Yeah.
set on fire.
Yeah. Any other thoughts about wax that we haven't touched on?
There's some people that they get it just in one ear. I swear, if it's going to be one ear, it's the left ear.
Really?
Isn't that weird?
No, I've seen the right ear.
I was like, the
Really?
right ear is always the
Oh
problem
no.
ear.
I feel like we need to have like a tally going.
Well, and then, when
Unilateral wax.
Which one's your problem ear?
when I used to oversee the newborn hearing screening programs at the hospitals, it tended to be like the left ear that would fail the
Absolutely.
hearing screening
Yeah.
because of the vernix that was in there, and
Yeah.
the way that they always laid all the babies in the nursery on the same side so
Oh.
the nurses could see all of them at
Mhm.
once. The one side would still have stuff in it, and then we couldn't screen their ear. And we're like, ah. And they come
I
back.
never knew that.
Yeah. Yep.
That's awesome. I mean,
Yeah.
well, it's awesome to learn it.
And earwax removal doesn't have to be painful, and we are very gentle
Correct.
in whatever way we remove it. A lot of people think that like, oh, we're digging in there with a curette or the water, that it's going to be this really
Cold.
cold, painful experience. And it's not. We have something called the ear spa, and we make sure that it's a really positive experience, and we explain to you the entire time what is happening and what our next steps are going to be for removal to make it not scary. Because I mean, we just told you don't put anything in your ear.
And then we're
You
going
come
in
into
there.
our office and we put a lot of things in your ear.
Yeah.
So
But
it doesn't have to be scary.
but we have a lot of candy.
We do.
We do. Like, we're not dentists, but sometimes we do touch a part of your ear canal that touches the vagus nerve, and it causes your eyes to water. It causes you to
Coughing.
cough. Yeah. And so we have the candy ready to go to try to soothe that. But
And sometimes it's a little uncomfortable, right? Based on the
Yeah.
type of wax, if it's hard, if it's, if you've got a lot of hairs inside of your ear, hairy ears, that can just catch. So it's not like it's just a walk in the park all the time, but it should not be painful.
it's like dentistry, though. Some people are super sensitive to
Oh,
have
yeah,
their
for
teeth
sure.
touched, and others, same with their ear canal. Some people are like, do it more. Oh my gosh, it feels so good. And
Yeah.
others are like, ah. And they
Right.
jump, and I'm like, I didn't even touch you yet.
Yeah.
They're just jumpy.
We do have a patient who knows that they are super sensitive to that and will take the chair, position themselves against the wall even, and kind of like hold their head knowing that they don't want to move because it is a delicate procedure.
Yeah.
That's why it should be performed by somebody who is licensed to do that, like a doctor of audiology. And so they just know to prepare themselves and say, I do this weird thing, but this is what I do so that you can do your job. And it's a beautiful thing.
And sometimes it involves putting drops in your ears and prepping the ear first, or sometimes you put the drops in before you come, or sometimes the drops only went this far in the canal and we need you to lay down and let it do its magic of softening the wax so that we can remove it without the pain. You know, it's
And
a
then
process.
we have drops in our office too that we
Oh,
can
yeah.
use to
Oh, yeah.
help, like on the spot.
Yeah.
So many options. Who
But our
knew?
goal is always
It's fun.
pain-free. You
Yeah.
know, that's
Yeah.
our end goal. And usually, I mean, we probably 70% of our patients that come in here have earwax of some kind that we're
Yep.
taking out. And it's, you know, we do it all the time. We're very good at it. And I said we try to make it the pleasant experience for everyone.
Yep.
And then they walk out and they're like, yay, I can hear.
Yes.
So fun. So fun. Yeah, we like to take out earwax, which seems gross to some people.
Hey, but you know what? If
thing.
that's your thing, and if you want to come in and be filmed to watch it happen, we support that too.
That's
Yes,
right.
we do. Yes, we do.
All right. Any other last minute things? If you have any questions, see an audiologist. If you're listening to this or watching this and you're not here in the Chicago area, we have many, many colleagues around the country and the world that we can refer you to do this the right way. Happy hearing. Have a great day.
Happy hearing.
Bye.
Thank you for joining us on this episode of the Hearing Wellness Journey podcast. For more information about what we do and the services we provide, please visit our website at hearingwellnessjourney.com/podcast, where you can find more resources based on today's discussion, as well as request to be a member of our Hearing Wellness Journey community on Facebook. That's available for our listeners exclusively on hearingwellnessjourney.com/podcast.